Great, thank you so much. Hi, folks, and hello, everyone, and welcome to today's session on cooking with gas, the health harms from gas stoves. This is a part of PSR Pennsylvania's PA Health Checkup series, and my name is Zach Williams, and I'm honored to be here to be your guest speaker today. I am the health educator and campaign coordinator for the Health and Environment Program with the Physicians for Social Responsibility National Office. I'd like to thank you all for joining today's presentation and for your attention over the next 45 to 60 minutes. First, some logistics. As I begin and continue with the presentation, please drop any and all questions you have into the Q&A function chat box. There should be a button labeled Q&A at the bottom of your screen. We will be going through the Q&A portion at the end of the session. I wish I could do 1,000 things at one time, but unfortunately I cannot keep up with the questions in the chat, in the Q&A, and do the presentation at the same time. So just feel free, anytime you have a question, drop it into that Q&A box and we'll get to it at the end of the webinar. And next, if we don't get to your question, please feel free to email me. My email is on the screen right now, and I will also drop it into the chat. If you had an additional question, want some more discussion, more than happy to discuss offline in an email chain. Also, if you have not already, please mute yourself to reduce the risk of any interruption during this presentation. Alrighty, without further ado, I want to give a little bit of an introduction to who Physicians for Social Responsibility is. Physicians for Social Responsibility is a national nonprofit founded by physicians with approximately 33,000 members and e-activists. It was founded with the mission to protect us from the greatest threats to health and survival. And today, PSR mobilizes physicians and health professionals to advocate for climate solutions and a nuclear weapons-free world. We contribute to the critically important health voice to energy, environmental health, and nuclear weapons policy at the local, federal, and international level. For today's training, I want to give you a little bit of an outline so you know what to expect going forward. Here are the 3 learning objectives for the next hour. So first, at the end of this training, you will be able to articulate how cooking with gas appliances produces dangerous indoor air pollution and explain the health effects of each of the primary pollutants. Next, recognize and prioritize vulnerable populations, as well as understand why they are vulnerable. And next, address the health effects of gas stove pollution and explain to patients and your family and yourself the steps you or they can take to reduce their risk. Next, I have a little bit of admin for our accreditation. This webinar training is accredited for a lot of health professional credits. Here is the big long blurb about the physician AMA credits that we will be offering. And here is the description telling you that I am not trying to sell you anything. Other than that, we also have nursing, social work, and pharmacist credits, and we will discuss how to claim each of those at the end of today's presentation. Next, I do have a quick pretest for all of you to complete. You can either scan this QR code on your screen right now, or I will drop the link into the chat. Here you go. It's 5 questions, not that much, and we'll take the next. I'll give 2 minutes. If you can quickly fill out that Google survey, that would be great. Thank you so much. And we'll come back around 1:10. Alrighty, folks, I'll give you another 10, 15 seconds. If you haven't finished it up yet, it's okay. It's not the end of the world. Alrighty then, let's trudge on forward then. So to truly start the beginning of this training, I have a question for all of you, which is, what's the first thing that comes to mind when you think of gas stoves? You can put it in the chat, you can unmute yourself and shout it out loud, whatever you feel most comfortable doing. But overall, what's the first thought, first emotion, first feeling that comes to mind when you think of a gas stove? Fumes. Great. Absolutely. Gas leaks. Absolutely. We'll be talking about those. You can smell the gas. My preferred method of cooking. We'll see. We'll see if we can change that by the end of this webinar. But I do understand you can boil water in like 30 seconds. I get it, you know. And you can smell the gas. Absolutely. You know, you can tell that there's something's up, something's coming out of that gas stove, you know. All right, great. Well, thank you all for your answers. Something that comes to mind, I'll just say, for me is that phrase, cooking with gas. You know, it's been a colloquialism in the United States since the mid-century, and it's meant to be a positive thing. You know, your car won't turn over and then all of a sudden it does, and now you're cooking with gas. It's a big PR push that happened in the mid-century from the oil and gas industry to tell Americans how great natural, quote unquote, natural gas is. But through the course of this presentation, you will see why that might not be so true. Alrighty then. So let's jump right on in. So no matter how you feel about gas stoves, the fact remains that using a gas stove without ventilation produces dangerous indoor air pollution. This leads us to the first section of this training, which is understanding the pollutants produced by gas stoves and the health effects they have on the human body. The primary pollutants produced by gas stoves include nitrogen dioxide, carbon monoxide, and particulate matter, which includes both PM 2.5 and PM 0.1. PM 0.1 is also known as ultrafine particulate matter, if you've ever heard that phrase before. Gas stoves produce a lot of many air pollutants, but the primary of which are NO2, CO, and particulate matter. So let's go through what these do to the human body. First, let's focus on nitrogen dioxide. Yes, nitrogen dioxide. It's a harmful air pollutant that is produced by the combustion of fossil fuels, including the methane we burn in our stoves. NO2 contributes to the development of asthma, aggravated asthma, and increased susceptibility to respiratory infections. And it's also associated with lower negative general cognitive functioning in general. Next, let's talk about carbon monoxide. It's another dangerous gas and probably more well-known than nitrogen dioxide. Exposure to carbon monoxide can have neurological effects such as fatigue, impaired vision, dizziness, all the way to falling into a coma. For cardiac patients, carbon monoxide can also cause chest pain, and at high enough levels or long enough exposures, carbon monoxide can also lead to death. Lastly, let's talk about particulate matter. PM 2.5 stands for any piece of matter that is smaller than 2.5 microns in diameter, and ultrafine particulate matter, or PM 0.1, is any matter that is smaller than 0.1 microns or 100 nanometers. For context, what that means is that particles smaller than 2.5 microns settle on the wall of the alveoli, where they then set off a cascade of inflammatory changes that lead to heart and lung disease. Ultrafine particles, those that are smaller than 100 nanometers, translocate directly into the bloodstream from the alveoli through lung and sinus vasculature and distribute widely throughout the body and can cross the blood-brain barrier and accumulate in brain tissue as well. So not great things going on. Both PM 2.5 and PM 0.1 can aggravate asthma, decrease lung function, and increase respiratory symptoms. It can also contribute to non-fatal heart attacks, irregular heartbeat, premature death in people with heart and lung disease. PM 2.5 has and ultrafine particulate matter have an asterisk next to them because in particular, the pollution varies based on what is being cooked on the stove. Particularly fats and oils contribute a lot to particulate matter, but particulate matter is also generated at lower levels when simply the burner is on. But the levels increase dramatically depending on what you are cooking in your pot or pan. Now, this is what all of these harmful air pollutants do to the human body, but how often and at how much concentration are we actually being exposed to them? So let's go through some exposure data right now. On the left, you can see the national standards and guidelines relating to NO2 concentrations. The United States does not have standards for indoor air pollution, so we use the outdoor standards as a reference. The US EPA National Outdoor Standard is 100 parts per billion, and the World Health Organization's indoor standard is 106 parts per billion. For context, 1 part per billion is like adding a single drop into an Olympic-sized swimming pool. So it's very, very small concentrations that both the EPA and the WHO say you shouldn't be exposed to this for more than an hour. Data from the Lawrence Berkeley National Laboratory show that in houses that were less than 1,500 square feet, indoor air levels of nitrogen dioxides exceeded EPA ambient air standards more than 83% of the time when people were cooking with gas stoves without ventilation. This goes up to 100% of the time in homes that are smaller than 1,000 square feet. From these data, we can see that using a gas stove without ventilation produces dangerous levels of nitrogen dioxide. And let's take a moment to look, that was a lot of words I just threw at you. Let's look at that graphically to really set in our minds what that means. So this is a graph from the Lawrence Berkeley National Laboratory study. As you can see on the y-axis, we have nitrogen dioxide concentration here, and then we have time of day on the x-axis. What the researchers were doing, they were measuring NO2 concentrations. As you can see, the red line is NO2 concentration in the kitchen, and the blue line is NO2 concentration in a hallway or a bedroom farther away from the kitchen. This house 3 was a home smaller than 1,000 square feet without proper ventilation. So this is kind of like worst case scenario of what is going on with your gas stove. As you can see, when each of these cooking functions were happening for approximately an hour, here is the 100 parts per billion, which the EPA says you should not be around for more than an hour. Every single cooking function, when you do not ventilate your home, increases the nitrogen dioxide concentration above the EPA limit. So when you're baking a cake, making a roast beef, pan frying something, each of those cooking functions are going to increase the nitrogen dioxide concentration to a dangerous level. So we see that, yes, the gas stove is producing a dangerous amount of nitrogen dioxide, but what does that dangerous level of nitrogen dioxide have anything to do with our health? So let's zoom into another case study and another graph to show that relationship between gas stove pollutants and, let's say, childhood asthma. So this is a study entitled Association of Changes in Air Quality with Incident Asthma in Children in California, 1993 to 2014. Essentially, the key points, all you need to know about this study is that it's a multi-level longitudinal cohort study over 21 years, one of the best representations of health effects over time that we have, the best kind of research methods we have to show health effects over time. And what the researchers found is that decreases in ambient nitrogen dioxide were significantly associated with lower asthma incidence. So what does that mean graphically? If we look over here on the left side of the graph, each of these different colors is a different community within the Los Angeles area. Over here, you can see on the y-axis, we have asthma incidence rate. And then on the x-axis, we have nitrogen dioxide concentration, but it's inversed. We have high concentration over here and low concentration over here. And as you can see, as LA started to get its act together and clean up the smog and the ozone that was all around the county and the city, you can see that there was fewer incidents of childhood asthma as there were lower concentrations of ambient nitrogen dioxide in the air. So what does that tell us? It tells us that when you lower nitrogen dioxide, you lower your risk for having an incidence of asthma. Now, the focus on children here is actually pretty important because it leads us to our next topic, which is vulnerable populations. Children are actually one of the most susceptible populations to gas stove pollution, and that's for a couple of reasons. First, they have an increased breath rate. Next, children have higher lung surface to body weight ratios and smaller bodies. So an NO2 concentration that could be safe for an adult could actually be harmful for a child. And lastly, children's immune and respiratory systems are immature and still developing. So they don't have the ability to deal with stressors in the same way that adults can. While we don't exactly know how the nice soup of NO2, carbon monoxide, PM 2.5, and other gas stove pollutants affects childhood respiratory illness, there isn't a study that takes all of those gas stove pollutants and relates it to childhood asthma. There's a meta-analysis looking at the association between gas stoves and childhood asthma, and it found that children in homes with gas stoves have a 42% increased risk of experiencing asthma symptoms and a 24% increased risk of being diagnosed with asthma, and an overall 32% risk of being of current or lifetime asthma symptoms. This may suggest that the multiple pollutants, that soup of bad stuff that's coming out of your gas stove when you combust methane, poses a higher risk to children than simply just a high concentration of NO2 alone. Next, I want to talk about environmental justice, because this is also a health disparity and a health equity issue. The focus on children and childhood asthma is important because it ties directly into this. Not every child is equally exposed to gas stove pollutants, and thus the distribution of childhood asthma is skewed. These data that I'm about to show you come from the National Center of Environmental Health's National Health Survey and a study from the Journal of Urban Health. I won't go through each prevalence data point, but I just want you to take a look at the numbers real quick. Let's look at housing. 21.8% of children living in public housing have asthma, compared to 7.38% of children living in private residences. When we look at race and ethnicity, the prevalence of asthma in Puerto Rican children is almost twice that of white children, and the prevalence of asthma in Black children is more than twice that of white children. And lastly, let's look at income level. 11.8% of children living below the poverty level deal with asthma, compared to just 5.9% of children who are living at 450% of the poverty level or higher. So living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, which is one of the most prominent health effects from using a gas stove. But why is this? So to fully understand why being a person of color and of low socioeconomic status puts you at higher risk for respiratory illness, in the United States, we have to look back at our history. So first and foremost, federal housing and transportation policies codified racism into the economic and geographic development of the United States in the mid-20th century. First, the Federal Housing Act of 1949 authorized the demolition of Black neighborhoods. And next, the Federal Aid Highway Act of 1956 authorized the demolition of urban neighborhoods labeled as urban slums and replaced them with the nascent interstate highway system. These urban slums were often majority Black, majority brown, or majority poor neighborhoods in major cities. This not only severed communities, which were most often Black neighborhoods, but also constructed long-term polluting transportation infrastructure next to, near, or through communities of color or poor communities. Secondly, although it's outlawed today, many majority Black neighborhoods are still reeling from the effects of redlining. A definition of redlining would be a homeowner's loan corporation categorization strategy where some neighborhoods were labeled as high risk, whose residents should not be given access to mortgages. These neighborhoods were outlined in red on their maps, hence the term redlining. However, nowadays, redlining now refers to lending discrimination that bases credit decision on the location of a property to the exclusion of characteristics of the borrower or the property. Who is the borrower? How does the borrower look or act? Where is the property? Who lives amongst that property? And that's the decision based on whether or not the credit decision is going to be made. Redlining prevented investments in infrastructure, green space, public transportation, business development, and all other aspects of city planning that make for a successful and prosperous and healthy neighborhood. Because banks refused to give loans to Black Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systemically address these issues. And when I say lack of political will, I do not mean a lack of political will amongst the citizenry and concerned citizens. I mean a lack of political will from those who have the power to pull the levers, and they simply aren't. I do also want to continue with the environmental justice discussion. Apart from just race and ethnicity, this is also a socioeconomic issue. This is a health equity issue, and lower income households are at higher risk of being exposed to high levels of gas stove pollution for a variety of reasons. First and foremost, low income folks tend to live in smaller unit sizes. And this is important because remember what I said a couple slides ago, homes that are less than 1,000 square feet exceed outdoor standards for NO2 100% of the time if you cook with a gas stove and do not ventilate. Along with smaller unit sizes, there are also usually more people per household compared to higher income households, which means more people are using the kitchen and more people are also being exposed to the gas stove pollution. Next, low-income families are also more likely to live in older homes and have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted or may even still have a pilot light, and are much more likely to have inadequate ventilation over the stove. Having a cooking appliance with a pilot light means that there is methane burning constantly in your home. It's great for convenience when you want ramen noodles at 2 a.m., but it also means that there is NO2, carbon monoxide, and PM 2.5 constantly being burned within your home. I do realize and know that most gas stoves now do not operate with pilot lights. There's a spark mechanism, but older homes may still have a pilot light gas stove. Next, low-income homes are also more likely to use stoves and ovens for heat. Homes with inadequate ventilation, poor landlord management, and poor insulation make families in these situations turn to the most readily available source of heat for relief, which is usually the kitchen oven, which does provide heat, heats the home and provides relief from the cold, but it also pumps this air pollution into the home for however long they keep that oven on to produce heat. Next, low-income homes are also more likely to have higher exposure to outdoor air pollution. As I explained in the slide before, these large permanent transportation infrastructures were often built through, near, or next to low income and communities of color, which is why they are exposed to more outdoor pollution, which then comes into the home when you open a window. Finally, low-income households are also more likely to have a greater asthma burden for all of the reasons we've talked about already, making them more sensitive to lower levels of gas stove pollutants. Now, I just threw a lot of depressing information at you, but before we get to the solutions, the upswing of this presentation, I have another question for the group. So again, unmute yourself, say it out loud, put it in the chat, whatever you feel like. For those of you who do see patients, have you seen any of these issues in your patients? And if you don't, if you're not a professional that sees patients, have you seen any of these issues in your personal life, in your family, in your friends, in yourself? Have you ever experienced any of these health issues that come from gas stove pollution? Frequently among inpatients with recurring admissions for COPD and asthma? Absolutely. Anyone with a chronic lung condition is definitely going to be impacted more than this. Another unconventional gas industry are terribly toxic. Absolutely. I'll say a personal anecdote of mine. I had a friend who heated her home with a gas furnace, and every winter her asthma would get incredibly bad. And then in the summer, it would go away. She recently switched to an electric heater for her home, and she no longer had intense asthma symptoms in the winter. And she finally made the connection that it was the gas furnace that was impacting her ability to breathe in her home. So before we jump into exactly what you can do when you're in a room with a patient, I want to talk about solutions in general for a quick minute. So to properly address this complex health issue, the solution must be multifaceted and systemic. First and foremost, the solution should address the target health effects the patient is experiencing and be within feasible and correct medical practice. Ideally, the solution should also incorporate and acknowledge the living environment of the target population or patient and should aim to improve the quality of that environment. The intersection of all three of these core aspects is the ideal, perfect situation and solution. However, we all live in reality where things are hardly ever perfect. So to that end, let's jump right into some things that you can do to mitigate the worst of these health effects from fossil fuel pollution. All right, so first and foremost, just like any other health issue, it begins with risk assessment. So what can you do as a healthcare professional to address this? Assess the patient and see if they are a part of a vulnerable population, or if they have any lifestyle risks or behaviors that would put them at risk for gas stove pollution exposure. So some at-risk populations, we've already talked about a couple, but here are some more. Children, the elderly, people with diabetes, people of low socioeconomic status, people who live with obesity, and people who also have pre-existing heart and lung conditions are absolutely at risk for gas stove, higher risk of being impacted by gas stove pollution. Next, do they have any lifestyle behaviors or behavioral risks that would put them at higher exposure for gas stove pollution or would impact their ability already to competently breathe? So what are their hobbies? Do they run outside in an area with a high amount of air pollution? Do they use ventilation while cooking? Do they even have access to ventilation in their kitchen? Do they smoke? Obviously, the integrity of their lungs is going to be degraded if they are a constant smoker. Do they use fossil fuels inside the home? Do they have a gas appliance? If it's not a gas stove, is there a gas water heater, gas furnace, any other kind of fossil fuel appliance? What's their time spent in heavy traffic and what are their in-car behaviors? Because certainly that constant exposure to car exhaust is also going to degrade the integrity of their lungs. And also, do they live near an industrial or a fracking site, which is also going to produce dangerous amounts of air pollution and hurt their lungs? Next, let's talk about risk management. So first and foremost, you want to, at the patient level, when you're in the room with a patient, of course, address any underlying health conditions that the patient is experiencing. And what I mean by this is if there's a child that's presenting asthma symptoms and doesn't have an inhaler, get them an inhaler. If there's some kind of medical issue that needs to be addressed quickly, of course, do that before we get into the preventative, more public health scope of things. I just want to also keep in mind about vague symptomology. A lot of those symptoms that I talked about are kind of vague: a headache, pain, wheezing, heart trouble breathing or coughing. That could be a variety of things. But I just want to put this in your mind when you're in the room with a patient to keep in mind that these vague symptoms may be signs of exposure to carbon monoxide or other volatile organic compounds that are coming out of gas stoves and fossil fuel pollution. When you're not in the room with a patient, this is more systems level things that health professionals can do because a health professional voice has so much weight when it comes to issues like this. You can join or urge your state medical society or medical specialty society to formally recognize the risk to health of asthmatic children when they are cooking with gas. The societies you're a part of should work to raise awareness among doctors and nurses by developing and distributing guidance and intervention recommendations. And raising your voice is one of the most powerful acts health professionals can do because they are a trusted member of their community. We hold a lot of weight and people tend to listen to us when we say, don't do this, please do this, when it is a matter of health at risk. To give you an example of a medical society doing something like this, the American Medical Association recognizes this, and their climate change policy adopted in 2019 recognizes the importance of physician involvement in policymaking and encourages physicians to act as role models for sustainability. Also, the Massachusetts Medical Society, as a state medical society, passed a resolution recognizing the connection between gas stove use and childhood asthma. So the ball's rolling. Let's see what we can do about the Pennsylvania State Medical Society. I know that will be a heavy lift. I'm not trying to say it's not, but any little bit helps, you know? Lastly, you can contact your local, county, or state legislators and ask them about any current electrification bills or policies that are on the table for this legislative session. Supporting these legislative electrification efforts as a health professional will add a needed weight to the movement and hopefully start to push some electrification policies through. And when we say electrification, we mean replacing gas fossil fuel appliances with electric appliances. Now, this is what you can do as a health professional, but the next slide, we're going to talk about what you can tell your patients to do and what you can do as an individual for you and your family to decrease your risk of exposure to gas stove pollution. I'm going to go through each of these bubbles really quick. It is a nice little summary slide of everything you can do. First and foremost, you can install and maintain a carbon monoxide detector in your kitchen. I will say about carbon monoxide detectors, they are often set at levels that they only go off when there is a fatal, deadly amount of carbon monoxide in the air, not necessarily the levels produced by a gas stove that won't kill you immediately, but over time will degrade your lungs pretty hard. So I would say make sure if you do want to install a CO monitor, make sure you get one that can catch CO levels at lower levels than what the typical standard is. Next, if available, you can run your exhaust hood while you're cooking. I know they're loud, I know they're annoying, but truly that exhaust hood is ventilation. Ventilate, ventilate, ventilate is the key takeaway here. And often I know, for example, I have a gas stove and I do have a fan over my oven. However, that is simply a fan in my microwave that blows the exhaust over my head and then mixes it in with the rest of the air in my kitchen. It's not perfect, but it's something. Something like that, coupled with one of my favorite solutions, is opening a window. It's free 99. Make sure you open a window when you're cooking anytime, but especially when you're cooking with a gas stove. It's probably the simplest way to get airflow and ventilation going. Now, I also do admit that as a lifelong New Yorker, I have a little bit of bias here because I realize that you cannot open a window during wildfire season on the West Coast. If there is a blizzard or a snowstorm, or if you live on the first floor in a neighborhood without a bar over your window and you don't feel comfortable opening your window. So again, I realize that there's some hurdles in front of opening your window. However, if you can't do that, I would also suggest trying out an electric appliance, some kind of plug-in electric burner, or a toaster oven, or a kettle, or an air fryer, any kind of plug-in electric appliance that means you don't have to use that gas range. Air fryers are great, so are toaster ovens, kettles if you need to boil water. And if you do need that hot plate burner, pan fry function, you can try a plug-in induction burner. Induction burners are completely electric, and there's no fossil fuel pollution when indoor fossil fuel pollution when you cook with an induction burner. Again, I'm not trying to sell you anything, but I did check some online retailers. Single burners are going for about $60 nowadays. Pardon me, and double burners are going for a little over 100. I know not everyone's made of money, especially now, but it's a step to take if you really do not want to use that gas range. Put a big old cutting board right over it and use a plug-in induction burner to reduce your gas stove use. To address the root cause of the problem, though, the solution is to rip that gas stove out of the wall. It's to replace that gas stove and oven with an electric induction stove and oven. That is the most expensive solution, and not everyone can do it because renters, landlord might not want you to do it. But if you have the means to, and if you own your own home, I highly suggest switching to an electric or induction stove. And I'm going to give them a spotlight real quick because I know we might have like horror stories in our mind of electric stoves, those resistance wire coils. It took forever to get hot. It took forever to boil water. But luckily, we're in the 21st century, and there have been some incredible improvements to electric stovetop cooking. So I do want to talk about induction stoves real quick. First and foremost, because they are electric, there are no indoor fossil fuel pollutants. Now, the majority of electricity in the United States is generated by the combustion of fossil fuels. So I'm not saying there's no fossil fuel pollution. There's just no fossil fuel pollution in your kitchen. There is fossil fuel pollution next to the power plant, absolutely, but there is no fossil fuel pollution in your home. Next, it lowers household accident risk. And this is because how induction stoves work is through magnetism. A magnetic field is generated when an electric current is put through a coil, and the resistance to that magnetic field in the pot or pan is what makes it get hot. That means that your stove isn't getting hot, the appliance isn't getting hot. So if you have a little one, grabbing and touching it isn't going to cause them to burn their hand. The pot's going to be hot. Don't let the little one touch the pot, but the entire appliance itself will not get excruciatingly hot. And next, it's an investment in your family's health. I know that not everyone is made out of money, and that not everyone can afford to rip that gas stove out of your wall, but a nice solution would be to put a big cutting board over your gas range and use that induction plug in, plug out burner while you wait for longer term, more systemic work that would decrease air pollution in general in your neighborhood, or bring electrification policies and building rehabilitation policies to electrify the buildings on a more citywide scale or township-wide scale than you yourself paying a couple grand to get an induction burner. I do just want to say about the function of the induction burner. Not every kind of pot and pan is going to work on it. It needs to be magnetic. So stainless steel, most pots and pans nowadays are some kind of magnetic and will work on an induction burner, but that ceramic tortilla warmer that you got is unfortunately not going to work. It needs to be some kind of material that can hold a magnet. So a good test is to rip a fridge magnet off of your fridge, get all your pots and pans, and see if it sticks. If it sticks, it's good to go. Next, I want to talk about something to wrap us up, because we're nearing the end of this presentation, is something that is not a solution, but is being touted as a solution. And I want you all to keep your eyes out for it in case it comes up in your area, which is hydrogen blending. This is a wonderful opportunity for health professionals to raise our voice, to say, no, this is not a solution. This is a bit of greenwashing on the part of the natural gas industry. So here's a heads up for those who are not aware of this. Gas companies are proposing to blend fossil hydrogen with methane gas. What that means is they're saying that they can reduce the amount of gas they use by blending hydrogen in to greenify the natural gas industry. That is a lie, and I will tell you why. One, it's bad for the climate. Hydrogen, the process of acquiring hydrogen in a way that we can use, it is an incredibly energy intensive process. It requires the combustion of a lot of fossil fuels to produce the energy needed to acquire usable hydrogen. The only hydrogen that doesn't happen is green hydrogen, which means hydrogen is created through a process called hydrolysis, and the energy for that hydrolysis is generated through renewable energy like wind or solar. Green hydrogen makes up 0.1% of the production of hydrogen in the United States right now. It is nowhere near at scale, and it is nowhere near ready to do what the natural gas industry says it's planning to do. So it's bad for the climate, bad for Mother Earth. Next, it's actually worse for our health as well. When you burn methane, all of those air pollutants that I've talked about for the past 45 minutes do get produced. When you burn hydrogen plus methane, you get an exorbitantly higher amount of NO2 in that soup of pollutants that come out. So it's actually not cleaner and not healthier. It's actually worse for our health. So let's not allow it in our kitchens. And so with that, I'm going to wrap us up real quick by asking you to please take a post-test now. I promise you are not getting graded. You are not, getting judged by these. It's so we can see learning achievement. And also, I would ask, there's a bit of demographic data. How did you like this presentation? Evaluate my presentation skills. What'd you like? What could we improve? So please scan that QR code if you have a smartphone, or here is the Google form link in the chat as well. So I will give us just another 2 or so minutes, and then we'll get going and get to the Q&A portion. Thank you so much. Alrighty, folks. So I'm seeing here on my phone that I may have talked longer than I usually do. So I'm gonna skip forward. If you have the post test open, please, I would love if you complete that survey, even if it's just open on your tab for the rest of this presentation, and you complete it in like an hour or so. Absolutely fine. Would love the data and feedback. Would mean the world. So thank you so much. Real quick before we get to the Q&A presentation, I just want to spotlight some of the work that PSR National and of course PSR chapters are doing, especially PSR Pennsylvania, in the realm of building electrification. So here are just some wonderful achievements that some of our chapters have made in the realm of building electrification, which this gas stove training is a part of. We're trying to reduce fossil fuel use and increase electricity use. I won't go through all of the wonderful achievements, but to spotlight PSR Pennsylvania, PSR Pennsylvania is encouraging and helping low-income folks with home rehabilitation programs to help with the electric transition, which is so needed, especially from an environmental justice perspective, because all of these solutions are great, but if there's a financial barrier, or if the home, if there's an older home that can't support this like new technology, and the folks who live in those homes can't afford to upgrade it, what are we going to do? It needs to come from the policy level and a community-wide program. So just wanted to spotlight the incredible work that PSR Pennsylvania is doing around Philadelphia. And if you are not already a part of Physicians for Social Responsibility, I highly invite you to come on and join us. I can drop our organization's website right there in the chat. You can sign up for email updates and action alerts. By all means, also, if you are a Pennsylvania resident, please, by all means, sign up for PSR Pennsylvania's chapter as well. And if this climate work and this environment work is really what gets you up in the morning and lights a fire under your butt, please, I invite you to join PSR National's Climate Ambassador Program. Here, you can work hand in hand with PSR National staff members on issues concerning clean energy, climate action, and any other kind of environmental work and environmental degradation work. And I highly invite you to join. It's a wonderful, wonderful program. Next, just some logistics for our folks that would like to claim physician credit. I can only speak to physician credit, and I'll invite Tonyain to speak about the social work, pharmacist, and nursing credit. But if you would like to claim physician credit for this training, you can either scan this QR code on your screen or go to the link that I just dropped in the chat. And I do just want to say really quickly a note from USF Health, which is where we get our accreditation from, is that if you're new to USF Health, there's going to be a couple questions to open an account and to get you into their database. That's going to take a couple minutes, but I promise the process works. And I also have a full list of instructions if you would like to, pardon me, if you would like to have a fuller, more drawn out step-by-step process to claim credit. And yes, I'm also seeing Tonyain in the chat. If you could please also in the post-test and any evaluation that you have, and to also send to her, please send your name and your credentials so that we can send that to our accreditors. Tonyain, do you want to speak really quick about the nursing, pharmacist, and social work credits?
Yes, absolutely. Thank you. And thank you for a great presentation. For those that are claiming credits for nursing, pharmacy, or social work, I will need to have you send me your name and credentials. I put my email address in the chat. You will receive your credits from Wilkes University, but without your credentials, they won't be able to look you up. They can, but it's just a little bit of a pain. And also that's only for folks who are licensed in Pennsylvania. So email me name and credentials, and we'll make sure you get your credits.
Great, thank you so much, Tonyain. And now, without further ado, with this last 9 minutes we have together, let's talk about some questions together. So let me grab the Q&A real quick. Here we go. All right. So we have a question asking, do air purifiers provide any help? I am not going to claim to be an expert on air purifiers or kind of like, you know, the ventilation technology that's available, but I would have to say that the function of an air purifier is to remove pollutants from the air. And I'm going to say yes, air purifiers most likely will work, probably for particulate matter, because it is particulate matter and not a noxious gas. For carbon monoxide and for nitrogen dioxide, I don't want to lie to you, and I'm going to say I don't know if an air purifier would help with those kind of pollutants, but I'm going to say for particulate matter and any other kind of physical solid matter, an air purifier would most likely help. Next, we have, does it help if people use electric toaster ovens for as much cooking as possible? Yes, yes, yes. The biggest takeaways I want y'all to take away from this training is one, ventilate, 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 and electric appliances whenever you can, which means an electric kettle, an electric toaster oven, an air fryer. Insert another electric appliance here. Anything that is plug in, plug out, countertop, store it somewhere else. Anything to decrease the amount of times you are turning on that gas stove or oven is going to help drastically. Absolutely. Next, I see, can you speak to the toxicity of uncombusted propane gas, which may leak? Now, thank you for this question, because I also know fuel sources vary very wildly across the country. Often I know people in the Northeast tend to use propane more than natural gas methane. For the toxicity of uncombusted propane gas, again, I don't want to lie to you. I'm not a propane expert, but there are a couple studies that have shown that the use of propane gas indoors is correlated with poor respiratory health. In terms of uncombusted gas, I'm sorry, I'm going to kind of turn your question to make another point. Uncombusted methane gas is absolutely dangerous to our health as well. Recently, there was a big study out of Stanford that shows that our gas appliances are leaking methane at much higher levels than any of us thought previously. And that's already on top of all of the methane that is leaking out of pipelines, getting the methane gas to us. There is a forthcoming study that should be published, I think, in the next couple months, that looks specifically at what that uncombusted methane does to the human body. And particularly, it is BTEX pollutants, BTEX. I'm so sorry, I do not remember what that stands for. All I remember, T is toluene. Either way, there are dangerous air pollutants that also come from uncombusted methane being leaked into your kitchen. So the end all is uncombusted gas is dangerous, combusted gas is dangerous. Let's just try and not use fossil fuels, y'all. Let's try and transition to electricity, which is the main point of this. Next, I see, is there significant leakage of gases when the gas is not turned on? So I kind of answered that question with the previous one. Yes, there is, I wish I had the link readily available, but I can email y'all the link after this as well, that the amount of gas that is leaked when the oven or stove is not on is dramatically higher than any of us thought. And that's coming out of a study from Stanford. It was published, I think, in January, and there was kind of like a bombshell moment. The New York Times wrote an article about it. WAPO wrote an article about it. Truly, if you Google Stanford gas stove study, it will most likely pop up. But yes, to answer that question, there is significant leakage of gases when the stove and or oven is not on. In the last 4 minutes, I'm just going to scan the chat real quick to see if I missed any of the questions. And it seems like we have answered most everything. So I want to leave you all with two fact sheets. One is focused much more on health professionals, and the other is kind of for a layperson general population. Please, by all means, take these and run with them. You can distribute them in your practices. You can keep them at home. You could, save it to your computer and never look at it. But these two fact sheets kind of sum up essentially everything I have said in the past hour, so you have it readily available. And thank y'all so much for joining and listening to me. What a great time it was. Thank you, y'all. Thanks, y'all.
Thank you.